From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and joining us in studio right now, the founder of the Vero Health Center. It is Dr. Josiah Fitzsimmons. Good to see you, sir.
You too, Lou. Thanks
All
for
right,
having me.
so today, it's going to be a knee slapper. Not really a slapper, because if you did that and you're going to be in pain, that's not what you want. We're talking knee pain today, and there are some options available that don't involve surgery to help your knee. Is that right?
You're absolutely right. Yeah, so many people resort to knee surgeries, and typically they only last about 10 to 15 years. And I always say if you want to live more than 10 or 15 more years, you don't want to get knee surgery, because then you have to get a second one, and every time they do, they have to chop off more part of your bone.
See, that's a valid point that some people may not realize. Maybe you've rushed to get some knee surgery and realize you have to redo it every 10 years or so. So it's not a permanent fix.
Yeah, it could take about 6 months of intensive rehab.
Wow.
It might not work. One out of every 3 people that get knee surgery wishes they didn't get it.
All right, now let's talk about what we're talking about when it comes to knee pain in areas that Vero Health Center can help on. What is your definition of knee pain?
Yeah, so knee pain come in all sorts of forms. You could have arthritis pain, you could have numbness, you could have tingling in your knee, you could have swelling, popping, crunching, as you can see on the screen, arthritis, tendonitis. Maybe you get up and you're very stiffness in the morning, where you've been sitting for long periods or sleeping in the morning, you're very, very stiff, or you try and move and you have pain with activity. It could be sharp pain, it could be dull pain. There could be all different issues, whether there's meniscus issues, whether there's joint space issues, whether there's bone spurs, whether you have bone on bone. All these different things could play in different factors and different symptoms that could arise.
Okay, now the treatment, as we've already hinted at, that some people automatically think surgery. That's not necessarily the best option. Drugs are another option that people have utilized.
Yeah, unfortunately. A lot of them are just masking the symptoms. Opioid drugs, creams, bandages, wraps, braces, surgeries, all things that are just masking the actual symptoms of the problem, not correcting the cause of the condition. And that's really what we want to focus on.
You try these quick fixes and you know they're not going to work. It's going to be, if you put a bandage on, as long as the bandage is on, you take it off, guess what? Pain is back. Yeah, pain is back.
Well, that's the big thing, Lou, about braces. Is typically when you wear braces, then your body starts depending on it. Then the muscles around the knee joint start getting weaker. Then you take the brace off and you're more susceptible to having an injury. Then you feel reliant on the brace and you feel like you can never take the brace off. And then your condition just keeps getting worse and worse and deteriorating more and more. And the big thing is you can't be active. Then you start gaining weight. Then you start having other health conditions, especially with the nice weather that we're starting to have. Your knees play such a vital role in your overall health.
Now, what do they say? It's a slippery slope. Yeah, you know, once you start down that slide, it's hard to recover from that. But can Vero Health Center help you? Well, there is a very, very easy way to find out, and at a price that is going to make you stop and go, what did he just say? Tell everybody about this.
Yeah, so $200 off, only $37. Come in, get a full knee evaluation, meet with one of our doctors. We just had a lady in our office that hadn't gone skiing in over 10 years. She'd been skiing out in Colorado for 20 years and came in, knee issues, came in. Not only did we get her back in Colorado this last winter for the first time in over 10 years, she was also able to dance at her daughter's wedding when she didn't think she could walk down the aisle for her daughter's wedding. She had a walker when she first came in.
Oh my gosh.
Knee issues. Not only she skied down in Colorado on the Black Diamonds, she also walked down the aisle for her daughter's wedding and danced. She sent a video from the dance floor. At her daughter's
That's
wedding.
awesome. You better hope you posted that. Did you post it yet?
We should.
He's going to. You have to post that, because that is what this is all about, is getting your life back and recapturing your life. And that's what you guys can do over at Vero Health.
Yeah, exactly. We're going to do a full examination, figure out exactly what's going on, what's causing the condition, how can we get to the root source of the problem, rather than just masking the condition with drugs, surgeries. Things are just temporary. We want to figure out how can we correct it at its source so we can get long-lasting results, impact your life really forever.
You see the number on the screen there, 515, of course, 335. Vero is the number, 335 VERO, VeroHealthCenter.com. If you want to jump on the web and find out all about that. But how gratifying is it when you see people be able to recover like that, when they come in and having a walker and can barely get around, and then being able to dance?
Yeah. I mean, that's the best part of my job. That's why I love going to work every single day, having that impact on people. We've had numerous people that have forgotten their canes in grocery stores because they don't need to use them anymore.
Well, that's a good thing for them, isn't it? Yeah.
Or these are all the fun stories that we love to be involved with, and people that can prevent surgeries, that can get rid of medications, that can stop doing all these things that are causing all the other side effects, get to the cause of the condition, get their body to heal the way it was designed to.
All right, there you have it. Maybe you can be part of the next really cool story of success from the Vero Health Center. 515-335-VERO is the number to call. $37. Get you the full evaluation like Dr. J just told you about.
Yeah.
Thank you, sir. Appreciate it.
Absolutely. You're welcome.